it's hard to believe, but the CDC, it reports that 1 in 10 Americans over the age of 12 takes antidepressant medication, while millions more take anxiety meds. Now, on today's show, we're going to be joined by medical experts who will answer your questions and offer tips on how to best manage treatments for depression and anxiety. Now, that is all coming up on this episode of Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
And welcome to Ask the Doc. No appointment needed, the show where the health questions that you send in, they're answered by our doctors and medical experts. I'm Julie Donaldson, and thanks so much for joining us today. We are very pleased to be joined by Dr. Madeline Camejo, Vice President and Chief Pharmacy Officer at Baptist Health, South Florida, and Dr. Michelle Krichbaum, the Clinical Manager for Pain Management and Palliative Care for Baptist Health, South Florida. Ladies, thank you so much for your time today and for joining us. We have some great questions coming in.
Thank you, Julie. Nice seeing you.
Let's get straight to it. We have questions from our audience. And first up, we're going to go to Lawrence. He mailed in and he asks, my wife and daughter, they're both taking anxiety meds, and thankfully, they seem to be helping. Can you talk a little bit about the advances when it comes to antidepressants and anti-anxiety medications? Well, Lawrence, thanks so much for writing in. But before I do turn to Dr. Camejo for her answer, let's watch this short video from the Mayo Clinic on teen and adult depression. Let's check it out.
Whether you are 13 or 30, anyone can be affected by depression.
It's a very real diagnosis, and it's different in adults and kids.
A typical adult symptom may include the classic depressed mood, says Dr. Marcy Billings.
In a child or adolescent, you might see more irritability, cranky behavior, isolative behavior.
The challenge is that it can also be typical teen behavior. Dr. Billings says it's the change in their normal behavior that can be concerning.
They used to want to hang out with friends, now they're not. Grades are suffering. They're struggling to get done what they normally do every day. They're tired all the time. They can have sleep problems. They can have eating problems.
Weight loss in adults is a common sign of depression, but can be different in kids.
You might see that they're not gaining weight appropriately.
Or they are gaining excess weight. The good news is that there are treatment options for adults and for children. A good place to start is talking with your primary care provider.
We can treat adolescent depression extremely well.
For the Mayo Clinic News Network, I'm Jason Howland.
Camejo, let's start with you on this because we know there's so many people struggle with depression and anxiety. So talk a little bit about the advances that have been made by the scientific community with these medications.
So over the last decade or so, a few newer antidepressants have come out that work a little bit differently than the older ones that we know, like Prozac, Zoloft, or even Lexapro. The first is esketamine. It's what they call Spravato. It's a nasal spray used for treatment of resistant depression. So it wakes up parts of the brain that have gone quiet in a depression by blocking a brain signal called NMDA. Now, this helps the brain form new connections more quickly, and it also works much faster than most antidepressants, and sometimes within hours or even instead of weeks. Then the next one is called Auvelity, and it's a combination of two medications, bupropion and the older antidepressants, which they're used for quitting smoking, and dextromethorphan, like the cough medicine. But they are very different doses and they're used in new ways. And these medications affect glutamate and the NMDA receptors, which are part of the same brain system. And so these new drugs like Spravato also tend to work faster than the traditional antidepressants. So sometimes as quickly as a few days. Now, the last two medications, which are more specific for like postpartum depression, brexanolone is an IV medication and zuranolone is in a pill form. So these medications act like a steroid hormone, like the body naturally makes during or after pregnancy, called GABA. And now this helps reset the brain's calming signals. And even with the pill version, the course of therapy is usually only about 2 weeks.
I think that's fascinating because so many people have the traditional medications that they're used to, but with so many advances, I think it's important to, if you're struggling with something, go in and see if maybe there's a medication that might work better for you going forward, because science is moving so quickly, and I think it's important for our health to make sure that we're with the latest medications that are out there. So thank you for that. Now, Dr. Krichbaum, this next question, it comes in from Wanda, and she writes, I've been prescribed anxiety medication. My doctor said he is giving me a newer medication. Can you talk a little bit about how these meds, they differ from the older ones as far as effectiveness and side effects, which we just touched on, right? Dr. Krichbaum, I'm sure so many people share Wanda's question. So tell us a little bit about these newer medications in terms of their effectiveness and side effects.
So, for the newer anxiety or depression medication that you mentioned, that probably means something like Vibrid, Trintellix, or even Auvelity that Dr. Camejo just spoke about. So, these work a little differently than the older ones like Prozac or Zoloft. So, Prozac or Zoloft are called SSRIs. So, we use the SSRIs and SNRIs. Those are considered the older meds. They're still very, very reliable, but they do take weeks to kick in and they don't work for everybody. So the newer ones try to cover that gap. So for example, Trintellix may help not just mood, but also the brain fog or concentration issues that a lot of people talk about. Vibrid aims to be just as effective as an SSRI, but with lower sexual side effects. And Auvelity is the first pill that can start working in just a few days rather than taking weeks, which is a really big deal when you want that relief sooner. So, as far as the side effects go, the traditional meds often cause things like sexual dysfunction, weight gain, or feeling flat. So, the newer ones still have side effects, but they can look a little bit different. So, Vibrid may cause some stomach upset, but like I mentioned, it may have less sexual side effects. Trintellix's most common issue is nausea, and then Auvelity can cause dizziness or changes in blood pressure, but it's also less likely to cause sexual problems. So, in short, the new medications aren't necessarily stronger or better, but they're designed to be smarter. So, either working faster, targeting additional symptoms, or having a different side effect profile.
And again, to that point, I think it's important to make sure that you have continual conversations with your doctor to make sure you're on the right treatment plan, right?
Yes, absolutely.
Okay. Well, our next question, it comes from Val, and she reached out to us through Facebook and writes, my friend was prescribed ketamine to help treat her depression and more importantly, her pain. And I was really surprised to hear that because I had heard that it was a very strong medication. Now, is that a new treatment and how safe is it to take? Dr. Camejo, tell us a little bit about ketamine and as it is prescribed as a medication.
So, ketamine is actually a very old drug that was usually done in anesthesia. And that's when you usually at higher doses. But research has found that if you actually do it at a lower dose, it's benefits for both pain and treatment of resistant depression. That is really an important piece here because I know ketamine in the past has been in the news for people overusing or actually not using it correctly. But otherwise, it really is designed to be administered in a clinic by a nasal spray, the newer version. It's called Keta RX, which was FDA approved for the treatment of post-surgical pain. That's one. As ketamine's safety profile at high doses, it's like using it in the operating we kind of talked about. It can cause hallucinations and make you feel completely dyslexic. But at lower doses, it's used for depression and pain. It's generally safe if it's given under medical supervision. And people usually are monitored in a clinic while they get it. And the side effects tend to be things like dizziness or nausea that usually wears off after the treatment. It's really not a medication that people take home on their own. And Michelle, I know you're a big specialist in this. Is there anything you want to add on ketamine?
So I will say I absolutely love ketamine. I love it in the treatment-resistant depression space. We use it every day in our sickle cell clinic for chronic pain management. So the one thing I know people heard about it in the news and with, Matthew Perry. So those are instances where people were overusing the medication. And like Dr. Camejo said, this isn't going to be something that you do on your own. It's usually in a controlled environment and it can be very safe when we use these low doses and it can also be really effective. So it's very exciting to have something old that's new again that we can use and is very effective.
And it goes to as well from what you just mentioned. I think a lot of people are alarmed a lot of times by these medications from what they do here in the headlines. But if taken properly and taken the right amount, it can do a lot of good things in people's lives versus sometimes how the headlines capture the negative aspect of that, right?
Absolutely.
Yeah. Okay. So, well, we're just getting started here, folks, and we still have a lot of time for your questions and to answer them. So here's how you can send them in.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, so far, so many already great questions that have been coming in and answered. So let's just keep it going. And our next question, it comes from Christine, and she writes, now, ever since COVID, I feel like I'm in a fog. I'm anxious all the time. And the weird part is I never was before. Now, based on what you said earlier, I know I'm not alone. I'm starting to think that I need to take meds to calm me down. So what should I do? Dr. Krichbaum, now we talked earlier about how many people and other people feel like Christine. So what can you tell her?
So, Christine, you're definitely not alone in feeling that way. A lot of people who never had anxiety or depression before started experiencing after COVID. So, there was stress, isolation, health worries, even the effects of being sick. It made sense that your mind and your body may feel a little bit off. So, the brain fog and constant anxiety are very real and it's very common, and you're not imagining it. So, as far as what to do, so the best first step is always to talk to your physician or a mental health professional so they can help figure out if medication is right for you or whether other approaches like therapy, lifestyle changes, even short term supports could make a difference for you. If medication is an option, there are both older and newer ones that we previously discussed that could be tailored to your needs with the goal of calming your anxiety without making you feel numb or like you're not like yourself. So it's also worth remembering that medications are just one piece of the puzzle. So things like therapy, regular exercise, good sleep, stress management tools are all things that can boost how well the medication really works. So you're not alone. There are safe and effective options, and reaching out for help is a strong and first and important step.
Certainly is, especially if this has been going on for years for somebody. And the challenge is like sometimes I think we feel we can power through it of knowing when is that time to ask for help. When would you say that is? At what point and what needs to kind of happen in someone's life to say, maybe I need more help here?
I don't think it's ever too early to get help, but it can definitely be, I don't want to say too late, but it's always later, right? The best day to ask for help was probably yesterday, and today is the second best time. So, anytime that you're starting to feel like maybe things are a little bit off, I think it's always worthwhile to have that conversation with your physician or mental health professional and see where they can go from there. It's not always going to be their first stop is putting you on a medication, but maybe doing some of those other things that you can work on
Right.
first before you get there.
Right, right. Again, just go ask your doctor and see where you stand at least, so you don't have to feel like you are alone in this process. Well, next we're going to hear from Travis, and he writes, I was let go from my job recently due to downsizing. Now, I know it wasn't anything that I did, but I find myself both anxious and depressed. Do these medications work well together, or are the doctors forced to treat one symptom but not the other? Well, Travis, thanks so much for your question. I think a lot of people are in this situation. Dr. Camejo, what can you tell us that Travis can do about the interactions between the meds?
I'm really sorry you're going through that. Losing a job, especially when it's not your fault, can shake your sense of security and bring on a mix of anxiety and depression. And the combination of having both depression and anxiety is very common. About 50% of patients with depression will also have anxiety. So the good news is that most medications used for depression also help with anxiety. So doctors aren't stuck using one or the other. And for example, medications like SSRIs like Zoloft or Lexapro, or even the newer ones like Treletex, are often used when someone has both. And they really target the same brain symptoms that influence mood and worry. So you don't usually need to separate the prescriptions and just to cover both sets of symptoms. So sometimes if your anxiety is intense, a doctor might add a little something short term to help with like a low dose benzodiazepine while waiting for the main medication to kick in. But overall, the approach is to treat both at the once, not to choose one over the other. So the short answer is yes, these medications can work well for both anxiety and depression, and your doctor will likely tailor the plan so you're getting relief from both, not just from one.
Sure, Travis has to be relieved to be able to hear that he doesn't have to suffer just in one area and maybe not the other, but there can be a solution. as he was going through both, and especially during a life change now. So thank you so much for that. We do have more questions coming in. Next, we've got this one from Jackie, who writes, now this may sound like a strange question, but are there foods that I should eat, or maybe more importantly, foods that I should stay away from that make depression and anxiety worse? Now, Jackie, that's actually a really great question here, and something to consider. Dr. Krichbaum, let's talk a little bit about the diet and the role that it plays in depression and anxiety.
You know, there has been a ton of really interesting recent research on the role of gut and gut health and its effects on different mood disorders, including depression, anxiety, chronic pain, autoimmune disorders. And so changing our diet is not going to be a cure for those things, but it can support or sometimes worsen the symptoms. So let's start with the foods that may make things a little bit worse. So the first is alcohol, right? And it feels calming in the moment, but it is a depressant and it can make your mood and your sleep worse because we know that it affects the REM cycle when you're going to sleep. So you may feel like it's making you tired, but the rest that you get isn't very restful, so to speak. The next one is caffeine. In South Florida, we all love our cafecitos, but too much of it can also affect your sleep, and it also makes you feel like your heart is racing, and it can increase your anxiety. And then the last one is highly processed foods or foods with too much sugar. So your fast foods, your chips, your packaged sweets, they tend to cause these blood sugar spikes and then crashes, and that can worsen fatigue and irritability. So which ones can help support our mood? So omega-3 rich foods. So our salmons, our tunas, our walnuts, flax seeds, those are linked to better brain health and lower depression risk. Our fruits and vegetables provide antioxidants and nutrients that also help support brain function. Then we have our whole grains. So our brown rice, our quinoa, our oats, they help keep that blood sugar steady so we're not having those crashes and spikes. And that can also help with mood stability. Your lean protein, so your chicken, your eggs, your beans, your tofu, they actually help make the neurotransmitters that Dr. Camejo was talking about earlier, like serotonin and dopamine, so similar to antidepressants, but in a more natural way. And then your fermented foods, so yogurt, kefir, kimchi, sauerkraut, they support your gut health overall, and that's increasingly tied to better mood and anxiety. So there's not a single anti-anxiety or anti-depression diet, but eating more whole, unprocessed foods and limiting caffeine and alcohol and excess sugar can make a noticeable difference for a lot of people.
I think that's so important. There's so many times where, you eat certain foods and you just feel better. You have more energy and you're more going, and others that can kind of pull you down. So this is definitely a fascinating question that was sent in. And thank you for that. I feel like I want to go and research even more to make sure that I'm eating proper to keep my mind and my mental health in line as well. But we do have a lot more to get to. So this next one's from Mike, and he reached out on Instagram and he writes, my son was diagnosed with Tourette's syndrome as a young man. Now, the medication he was given, it helped, but it also made him gain a lot of weight. And now we are dealing with anxiety and depression along with Tourette's. Now, in some ways, these side effects are harder to deal with than the original diagnosis, and I just don't know what to do anymore for him. Mike, we're so sorry to hear that your family is struggling with this and these issues. And it sounds like a question that a lot of our viewers probably have. Dr. Camejo, what is it that you can say to Mike?
That sounds really tough, and it makes sense when you feel worn out trying to help him through all of this. Now, you're not alone. Many families do deal with Tourette's, face the same challenges. The tics themselves can be manageable, but the side effects of the treatment, the added burden of the anxiety or depression can feel overwhelming. A few important things to know. It's very common for people with Tourette's to also have anxiety, depression, or even ADHD. Sometimes those conditions end up causing more daily stress than the